Back in 2002, I was leaving my first art therapy job at a therapeutic day school that I had been at for quite a few years. And I decided to take a job in Arlington County, which is a suburb of Washington, D.C., as part of a post-9/11 grant. I was a school and community-based mental health therapist, where I offered short-term therapy directly in the community, did debriefings when there were community traumas, and conducted intakes in order to try to move people into longer-term services. It was in many ways like the ultimate clinical job, the job I was always told I should try to strive for when I was in graduate school. And then 3 years later, a job opened in the Department of Parks and Recreation and Cultural Resources in the art unit for an expressive arts programmer. And in that job, people would create arts programs for not so much for skill building, but for the love of creativity, to enhance imagination, and to bring people together through art materials. And I applied for this job, and I got it. And I designed the programs as well, but due to my training as an art therapist, they often asked me to work with the special groups, with adults with cognitive disabilities, with adolescents with physical disabilities, with senior adults, with children with behavioral problems. And I loved this job. But in my new role, I often wondered, was I still an art therapist? And was I actually doing art therapy? Now, each of you probably have an answer that's popping into your mind about this, and I bet that the answer to this question depends on what your definition of art therapy is. But more so, it probably points back to how you think of our profession, and to a large extent, that links each of us to a particular art therapy lineage. Now, without a doubt, the early art therapists who founded this profession had a range of different views. Meyer Levick pursued a psychoanalytic approach, steeped in psychotherapy traditions. Don Jones emphasized art making in the studio. And as much as these and others differed, they shared an emphasis on the identification and remediation of mental health concerns. Eleanor Ullman noted this phenomena when she described the debate at the very first American Art Therapy Association meeting in 1969 over whether art therapy registration criteria should require experience in a psychiatric setting. And many decades later, Pat Allen also named that as the clinification syndrome, which favors therapy skills to the detriment of artistic experience in our profession. Harriet Waitson thought that heavily clinical focus limits the recognition of our profession's diversity, and Lynn Capitan worried that if we held on to this too long, we would start describing things as art therapy and not art therapy. And what all this does is it promotes a misleading idea that clinically oriented art therapy is the norm and everything else is derivative. But what this notion actually does is it ignores our actual historical traditions. Because in addition to the recognized art therapy family tree, there are many other art therapists who are working in the 1960s and through the early days of the profession who held other visions. And of these voices, many of them were art therapists of color. They created their style of art therapy formed by the needs of their communities, their settings, and the clients of which they served. Now, their stories were mostly preserved by members of the Multicultural Committee, but they have been published more over the last 15 years, and all of them were known people at some point in this profession. So I want to take a few minutes now to lift up their names and make sure we remember who they are. So Cliff Joseph holds many firsts in our profession. First black member of the American Art Therapy Association. He was invited to the very first meeting at Hahnemann Hospital in 1967 at the invitation of Edith Kramer. And he was the first black art therapy professor as a founding faculty member of the program at Pratt Institute. He started as a graphic designer, but started to use his own art as a way to express his views of the world, particularly related to social justice and civil rights, and then wanted to start to offer that to other people. So he began to work in psychiatric services. And one of his lasting contributions, a book that is kind of hard to get now, but I recommend if you can, Mural of the Minds, that he co-authored with the psychiatrist on the ward, Jay Harris, is all about how he used mural making in inpatient units through democratic processes, where they came up with the themes themselves, they interpreted it themselves, although he offered some guidance, and helped them to figure out what they needed and what would work for them. And he took this to the extent that he once advocated to the psychiatrist for the right to bring some of his black patients out to join a protest and be part of the civil rights demonstrations, believing so closely the connection between social illness and personal illness. Sarah McGee began working in the 1940s with a focus on the urban poor and migrant workers. She actually would use art materials that were found in the fields in order to help for the migrant workers to feel comfortable with the art materials they were using. She would work side by side with her husband, Dr. Scuddy McGee, who's a psychologist. He would offer the therapy, and then the patients would sometimes, or the clients would leave and then go into her art studio afterwards. Dr. McGee had a real intense interest on alternate ways of thinking about health. She studied for over a decade with the Lebu people in West Senegal on their cultural health traditions. And even though she did not lead her clients in any kind of ceremonies, any kind of Lebu ceremonies, she used this as a way to inform different ways of thinking about health. And she would integrate into her art practice, her art therapy practice, drumming. She would introduce community rituals. She would bring in textiles and cloth. And she did this throughout, for 50 years of working in New Jersey with children and in domestic violence. Wayne Ramirez moved to Philadelphia from Puerto Rico to get an MFA at the University of Pennsylvania, pursued the fine arts, but always wanted to work with people, particularly with kids. And it was when he was working in a residential facility in Philadelphia that he first learned about the Bulletin of Art Therapy. Soon after that, though, he moved to Milwaukee, where he did a degree in counseling, and he also was working in psychiatric services there. And he was one of the founders of the Wisconsin Art Therapy Association, an association that purposely did not call itself the American Art Therapy Association because they didn't want to presume national dominance. But when ADA did form, he was there at the first meeting, and he advocated for a broad approach to the field that focused on rehabilitation, community services, and education. When Wayne and his wife Marianne, who's also an artist and a programmer, moved back to Puerto Rico, they worked in education and looked to see how art therapy could be paired with IEPs to complement academic and cognitive performance. And when they were living in the U.S. Virgin Islands and Hurricane Hugo hit, they repurposed an old decommissioned bus, filled it with art supplies, and a team of art therapists, artists, and health providers to bring the art studio to where the people were. Georgette Seabrook Powell is considered the youngest artist from the Harlem Hospital in the Works Project Administration, and is considered an artist in her own right as part of the Harlem Renaissance. When she was in New York, after she lost her mother, she learned about Edith Kramer and art therapy. And from Edith Kramer, she met Eleanor Ullman. And when Miss Georgette Seabrook Powell moved to Washington, D.C., because of her husband's work, she began to work with Eleanor Ullman in psychiatric services. When Eleanor retired and Georgette was passed over for promotion, she went and worked in senior services in the Department of Parks and Recreation. And later in the early 70s, founded her own arts organization where she offered art classes when they were needed and art therapy when it was needed. And then she had an annual event she did in Washington, D.C., where she brought art into the parks in order to help people just be creative. She is recognized as a fine artist, and the Blue Cross Blue Shield actually honored her with the Ageless Hero Award for Creativity, and it was bestowed upon her by former President George H.W. Bush. Lucille Venture was the first person to get a PhD solely focused on art therapy. Her dissertation, the first half of it, focuses on her take of the history of the profession and her concerns with how a focus on psychotherapy alone was going to be limiting to Black children and to other clients. The second half of her thesis documents her work. Her work in what she called the Crisis Art Therapy Program, which was based in a school and focused on behavior management, and also her work in the kids' room, where she actually worked in the waiting room of a mental health clinic for kids who were anxious about their appointments that were coming up in order to help them feel better about it. She was a founding member of the Maryland Art Therapy Association and was also very active in ADA's early attempts for recruitment of art therapists of color. And Christine Wang is an art therapist who was born in Shanghai. Her family moved to the US and ended up having to stay here at the outbreak of World War II. Even though she returned to, at that time, in Hong Kong for a little bit, she came back to the US to finish her degrees. And it was at the Connecticut College for Art, for Women, where she was studying art, that she met Myra Levick and was introduced to Margaret Naumburg. When Miss Wang moved to Washington, D.C., she founded 2 art therapy programs at D.C. General Hospital and at the George Washington University Medical Hospital. Myra Levick invited her to be the director of the Hahnemann training program, which is now Drexel University. And then Miss Wang moved to Baltimore, went back to Baltimore, where she founded the Goucher College Art Therapy Program that was around for parts of the 80s. If you wanted to go to the first art therapy conference, she was the reservations chair. And she was also the treasurer in the early 70s. She was very much focused on a psychodynamic approach to art therapy, but insisted that we needed research. And her insistence on research garnered her much attention and respect from colleagues at Johns Hopkins University Hospital in Baltimore. In addition to her work inpatient, she noticed the need of providing services to unwed mothers in the 1970s who were not receiving services and were also affected by stigma. And in her work, she identified what she called graphic transference, which is looking at how the art therapist is portrayed by the client in order to understand how the relationship is progressing. And in her dissertation, she writes about her own creation of art to identify her own countertransference in order to stay present in what she was doing, what we would now refer to as response art. So when we mention traditional art therapy, I think we need to be careful. I think we actually need to specify which tradition we mean. Individually and collectively, these pioneers represent various roots. And actively naming them within the pantheon of founding art therapists offers us some important forms of representation. The first is that racial representation matters. We are a field that often is accused, and rightly so, of being white and monocultural, and the idea that there are people who are outside of that tradition. Our field has never been just that. There has always been a range. And the other is that this offers a theoretical representation for all of us. When we think about how to apply our work and what jobs we end up in, that there are ancestors to go with. So going back to my story, when I made that transition from Department of Human Services to Parks and Rec, I was quite fortunate that a few months later, I met Georgette Seabrook Powell, because my work in the Multicultural Committee and documenting history brought me into the presence of many of these folks. And it gave me great comfort to know that there were others who did this path before me and could bring art therapy into places where it would be unusual to find it. So my suggestion is that when we restore them to their proper place in our collective family tree, we don't actually displace anybody else. We just widen the tree and make more seats at the table.